Hey everyone, good morning and welcome to our webinar. My name is Tommy Hunkins and I'll be moderating today as we shed some light on the challenges a paper-based informed consent process can create and the positive impact a mobile electronic solution can have on compliance, costs, productivity, and satisfaction across your healthcare organization. A few things I want to note before we get started. Attendees can submit questions throughout the webinar via the questions or chat sections of the user panel. I'll collect those questions as we go along and present them to our host towards the end of the session. If you experience any technical issues, please contact me via the chat in the user panel, and I'll do my best to assist. And lastly, we will be sending out a recording of this webinar after the presentation. I wanted to go ahead and give a brief intro of our presenters today. First up, we have Robin McKee. Robin is our Director of Clinical Informatics and Solutions. She's a registered nurse with over 20 years experience in a variety of healthcare settings. It's her job to understand the problems that clinicians face and ensure that FormFast provides solutions that address not only the problem, but workflow around them. Following Robin, we have Ryan Brown. Ryan has been a solution architect with FormFast for 5 years. Today, he'll be walking you through the product demonstration portion of our presentation, and we'll be able to answer any technical integration questions that you may have. So without further ado, I will be passing the reins to Robin, and she can get us started.
Excellent. Thank you very much, Tommy. And hello, everyone. Thank you for joining us today to learn a little bit more about the informed consent process and the impact that your informed consent process is having on your organization today. I wanted to kind of level set the definition because I know we probably have a lot of different roles on this webinar today. So I simply want to start out by saying, what is informed consent really? And it's more than the form. We're FormFast and we're talking about the form today, but this is about the communication that takes place between the provider, oftentimes the nurse or other clinician, and the patient about the procedure, surgery being recommended, being performed. But the form does play a really important role because it's the proof, it's the document that says that this communication happened. And the better designed your informed consent form is, the more that can help guide everyone to a standardized, consistent discussion that is going to inform the patient. So they're an educated participant in their care. And that's ultimately the whole purpose, is for this informed consent process to make the patient feel like they know exactly what is going on, risks, benefits, alternatives, what would happen if we didn't do this at all. And so it is really important to remember that while we understand that the conversation, the process is really the key, the form drives that process. And so I got to click over here to make sure my screen advances. There we go. And so many of you, likely most of you, follow this typical informed consent process you see on the screen today, a very paper process that has to be manually completed, manually labeled, might be in a temporary small folder in a patient's temporary chart until they go home. Then it gets sent to be scanned, and ultimately it ends up in the EHR. That describes the bulk of what folks in the U.S. are experiencing today. But we're going to talk through this process so you can understand why this heavy manual process really increases the risk of errors, of misplaced forms, archival errors, and other risks and problems that we're going to dive into. So what I hope that you're going to learn during this webinar today is that FormFast has a better way. Not only are we going to instantly archive this consent form into the EHR so we avoid all of those lost consent pitfalls and problems, but we're going to walk through some of those other issues with paper consents and with consent forms in general that having an electronic process, specifically a FormFast process, is going to improve that drastically. So the biggest elephant is just missing documents. Now, the fax might not get to the right place, or we're in an academic institution and a resident has this consent form in their pocket as they're going from place to place to place. And a lot of times with the paper process, these forms are getting lost, or sometimes maybe they were scanned, but they were scanned improperly. So when you go into a patient's record to find this consent, you can't find it. So we know from research, a JAMA Surgery article states that nearly 2/3 of procedures have missing consent forms on the day of surgery. So 2/3 are missing, and that's providing some pretty decent complications for clinicians as far as being productive, their satisfaction, risk to the patient, and more. So we're going to dive a little deeper into the financial impacts, the compliance and risk impacts, how this affects your productivity, your patient and clinician satisfaction. So let's dive into those bit by bit. So first off, let's talk about the financial impact. So not even to talk about the cost of the paper, the copying, the labeling, the scanning, the secure disposal of those documents once they've been scanned, but this has a big impact on your procedure rooms, on your OR rooms. So when you're having to spend time to search for missing consents, you're delaying and postponing procedures that down the line adds up to a larger percentage of delays and can amount up to a pretty hefty figure. This particular article cites up to $500,000 a year in lost time because of idle procedure rooms and OR rooms due to those types of delays. So pair that with all of the supply and people processes around a paper process, and this starts to add up to a big financial cost. As far as the compliance and risk problems that occur because of informed consent failures, several of our customers come to us for an automated electronic process because they had a Joint Commission inspection and they were not able to locate their consents, or they were not able to prove that they had an adequate informed consent process. And they're not alone, because Joint Commission themselves say that in 2016, over 500 organizations had compliance issues with their consent forms. So now if you think about how many organizations and that Joint Commission inspection cycle, you may be among that 25+% of folks that could be dinged for compliance issues with informed consent. So that can translate down into, not only do you not want to get dinged the first time when Joint Commission comes to see you, but if you do, then we all know that that turns into, yes, we have to come back. And once we come back to make sure that your informed consent procedures are back up to snuff, it also means that we can come and inspect everything else. And I know from personal experience at the bedside that everybody is a little tense when Joint Commission comes around, and having to face them coming back and looking anywhere they want is also a big stressor. But all in all, you just want to avoid these failures, and it's easy to do so with the right solution. Another problem is increased liability. So fully 2/3 of malpractice cases are citing lack of informed consent as the reason for the litigation. And so having an inadequate consent document increases that risk and liability in the instance of malpractice claims. So if your form is not proving what conversation took place, if your form is not proving that this patient was adequately informed about the procedure prior to it occurring, you're opening up the door for that dissatisfaction and potential malpractice claims moving forward. Productivity and quality are also impacted. This was a mind-boggling statistic for me. A poor form process, a paper process, still exists in over 3/4 of organizations today, instead of any other type of e-signature technology. So a paper process that, as many folks that we've gone to see, it's copied forms sitting in a file drawer, or it's going on to an intranet and printing off an informed consent. And it takes time to do that. And then in many cases, we're having to manually fill these things out. There might be some pre-canned text on that consent form, but there's a lot of time spent in just completing the form. And that's taking away time from actually having a conversation with the patient. And so in this age of EHRs and everything digital, the fact that 76% of our organizations are still doing informed consents on paper means that there is a problem, and it's a problem that we can fix. Low quality and legibility is really a huge problem when it comes to paper consents. And you can see on the right, probably a more extreme example of a poor quality consent form, but I also wouldn't be surprised if some of you are nodding your head saying, yeah, our generic consent looks something like that. And so CMS does have guidelines. It has minimum elements for a consent form, as well as elements that comprise a well-designed consent form. And many to most consent forms don't even meet those CMS guidelines. I certainly would not want to be a patient signing this particular consent form. I've been away from the bedside long enough that I am not quite sure what an RRP plus or minus bilateral PLND is, and I wouldn't want to be a patient signing for that either. There's also a profound impact on satisfaction, and we're not just talking about patient satisfaction, but also clinician satisfaction. So we're hearing a lot on the news and around the internet of clinician and physician burnout becoming more and more of a problem. And fully half of clinicians often or always are feeling burnout symptoms. Paperwork burdens are the main reasons that they feel dissatisfied, according to this advisory board study. And so you can imagine this extra paperwork that does not have to be done this way is helping to contribute to that clinician burnout. Not only are clinicians and providers dissatisfied, but patients are dissatisfied as well. So a lack of patient engagement, a lack of understanding can lead to some negative consequences. So we know from these studies that a patient and procedure-specific consent form can contribute to an optimal patient experience. And we want our patients to not only be satisfied with the outcomes of their surgery, but on a broader perspective, satisfied with the healthcare they're receiving in our system. And so several studies I have cited here that say that a proper informed consent process is going to improve the knowledge retention and thus the preparedness for a particular procedure. This first study said that the risks and benefits were remembered better for patients post-surgery whenever there was an adequate informed consent process preceding that procedure. Another study cited that the largest predictor of patient satisfaction is just having those pre-surgical expectations met. So I knew what was going to happen during this surgery. What I was told was going to happen is actually what happened. And that is directly reflective of an informed consent process that is thorough, comprehensive, and patients feel prepared for what is coming. So really, the summation of all of these different impacts of informed consent boil down to what we like to separate out as two separate ripple effects that are very interconnected. So you might be on this call today and you might be someone who's more at the tactical level, boots on the ground, you're dealing with informed consents every day, and you understand these particular problems of having lost documents and it's too much paperwork that I don't need. The form is not designed properly. I have to write in so much, promoting errors, it costs so much to scan. All of these issues that are kind of the boots on the ground problems. But really, this also leads and contributes to larger strategic goals and strategic issues that maybe those of you on the call that are decision makers and strategic leaders in your organization can appreciate, such as that clinician burnout and engaging our patients and making sure they have a positive experience, avoiding those audit failures and being more financially responsible with our dollars, and heaven forbid, avoiding those never events because of improper communication about a procedure. So what I encourage you to do today is that if you're listening and you are a tactical owner of these problems, to really identify and think about how we can communicate to your decision-making leaders some of these issues that contribute to the strategic problems of your organization. And likewise, if you're listening and you're a part of the strategic leadership that has influence over some of these larger goals, really think about how this process is contributing to some of those larger goals that you have for your organization, because they really are so interconnected. And so what we're going to show you today, all of these things that we've talked about really are leading to an easier, better way to conduct your informed consent. And so Ryan is going to show you in just a moment our e-consent process, but I just want to wet your whistle while we're talking about all of these problems that we just finished discussing, to talk about e-consent in a mobile, accessible manner really does solve all of these problems that we just spoke of. We're able to pre-fill information onto this informed consent, so you're not spending time manually filling it out. Why can't you just receive a message from the EHR to pre-fill not only ADT information, but other HL7 information as well, such as the procedure, provider, anything that we can receive from the EHR that's going to help pre-populate this form means less time for you to fill it out. Not only that, but we can bring in standardized fixed content that your forms committees or legal teams have already approved and said these are the types of things that need to be on our form, but also be flexible enough to have fillable fields, drop-down fields, check boxes to allow for some flexibility that makes this consent form specific to the procedure, to that patient. Not only that, we can help improve the communication process by embedding hyperlinks to educational content. You likely already have an educational vendor or educational content in your healthcare organization. Why not make sure that what you want to be used for education is immediately available during the discussion process right on your consent form? And then, of course, the e-signature capabilities, having the amount of signatures that you need, the required fields, required signatures that you need to satisfy, whether it's witness, whether it's phone consent, that you can have the signatures that you need available for that particular consent. So with that, I will turn it back over to Tommy so Ryan can pick up and walk through a demo of obtaining informed consent.
All right, thanks, Robin. I will go ahead and make Ryan Brown the presenter.
Thanks, Tommy. Thanks, Robin. So as Robin was saying, what I'm going to be doing today on the demonstration, I'll be using my Apple iPad to showcase FormFast Go, and the workflow use case here will be the staff member, the nurse, and the provider could walk into the patient's room, easily scan the patient's wristband to identify the patient, bring up the informed consent that the patient needs to sign, and then have that information flow back into the patient's chart here. So what I'm going to do here, I'm going to share my iPad. You'll be able to see it here, and then I'll begin the process of walking through FormFast Go. So within FormFast Go, once the staff member authenticates in using their Active Directory credentials, they'll be able to walk into the patient's room and very easily click tap here to scan the barcode. So again, the use case, the nurse, the clinician, the provider, they can walk into the patient's room, tap here to scan the barcode, and this will activate the camera on the mobile application. So in this example, I have a wristband for Maggie here, and I just have the barcode covered up, because you'll notice as soon as I remove my business card, FormFast Go will scan that barcode immediately and bring up any of the consent forms that Maggie needs to sign. So we'll remove the business card, barcode will be scanned, and now the consent form for this orthopedic surgery procedure will be launched automatically. As this form launches, you'll notice in the upper right-hand corner, as Robin was saying, the patient demographic information will flow across from your EMR and be merged onto the form surface. Down below here, this is orthopedic surgical consent form. And one thing you may have quickly noticed is that my description, alternative procedure, risk, etc. are blank. And what's great about the FormFast capture solution for informed consents is you're able to build out drop-down lists of content that's been approved by your legal teams. to pre-populate the forms with all of that information. So rather than maintaining a bunch of individual informed consents, you could standardize, consolidate by your departments or different procedures, and then have those procedures available in a drop-down list, or we could also have that information flow across in an HL7 message to pre-populate the form. So you'll notice as I choose ACL reconstruction here, we'll automatically insert my procedure description, alternative procedure, common risks, etc. And if I were to change that to a total knee, that will update the form in real time for my total knee procedure. Now with this particular informed consent, I have a side of the body that's highlighted in red, and I chose to make that red field required, that I must choose, either left or right side of the body. So any of my red fields have been marked as required, blue fields are optional, and as we're building out and loading your forms into the FormFast system, your hospital can pick and choose what fields should be marked as optional versus required. Another great feature of FormFast Capture is the ability to free annotate onto these form surfaces. So your providers are used to using a pen, marking up body diagrams, mouth diagrams, eye diagrams, etc. Just like on paper, they can choose the option to free annotate, and then they could draw on the body on where the procedure will occur. Down below here, you'll notice that on this particular form that I have an additional physician notes field. So for your providers and nurses, they could enter additional information that is not pre-populated simply by clicking on that field, and that will pop up the virtual keyboard and allow me to free type onto that form surface. Another great feature is, with the Apple iPads, is the ability to use Siri to dictate onto these forms. So I could very simply click the microphone icon and then dictate to have that information automatically inserted onto the form surface. Patient is a diabetic, period. Jumping over to the second page of the document, you'll notice at the very top, just as Robin was mentioning your web-based educational content, we can include hyperlinks that will link out to that content. So directly from your consent form, you can link out to a total knee replacement video, a total knee replacement diagram as well. Down below, a couple other drop downs here. So for Maggie or patient, I could choose the drop down that Maggie will be signing the form herself. And then for our surgeon, we could say, Dr. James Sawyer will be performing the procedure. Scrolling down, you'll notice that information is automatically pre-populated below the signature boxes. And again, this form has two signatures, one required signature for the patient highlighted in red. And just for demonstration purposes, I chose to make the physician signature optional, and that's highlighted in blue. I'll choose the option to agree to a blood transfusion. Once I'm ready to gather my signatures, I could click on the patient signature box, and this will launch a larger signature capture window. Now, FormFast Go can capture as many signatures as necessary. So in this example, I just have my patient signature and a physician signature, but I could have, family member signatures, witness signatures, etc. At teaching hospitals, you may have the attendings and the residents both signing off on your consent forms as well. So as many signatures as you need to capture, we could support that within FormFast Go. To capture Maggie's signature, I could either use my finger or a stylus, so I could hand my iPad over to Maggie or patient. She'll be able to write her name on the consent form using her finger. Clicking on accept, that will apply Maggie's signature to the document. Below the signature, we'll insert the date and timestamp automatically, and now the physician is able to sign the document as well. So I could hand the iPad back to James, our physician. He'll be able to use his finger or stylus as well, write his name on the consent form, and apply his signature to the document. FormFast Go and FormFast Capture also allow you guys to build workflows behind your consent forms as well. So in the event that not everyone is available to sign the form at that one time, you could save the consent form, resume it later on, or even route it over to additional parties for review and signature. Once the form's been completed, if the patient asks for a copy, you could click on print at the top. This will automatically print out the consent form back at the nursing station or a centralized printer, where you could provide that form to the patient. Otherwise, you could click on approve, and this will send the form directly back into the patient's chart, and the EMR will be filed electronically. There's no need to print out the form, scan it back in. You eliminate that delay. You save the paper. It's immediately available once you click on approve to send it back into the patient's chart. So with this, I'm going to turn it over to Robin to continue her presentation, and then at the end, we'll be able to open this up for questions regarding FormFast Go and FormFast Capture.
Thank you, Ryan. I will switch it back to Robin.
Thank you both. Let me flip back over to my screen.
I can see your screen.
So thank you. So just to round out the demo that you saw, I'm sorry, I've got a little bit of feedback if Ryan or Tommy, you want to mute. What you saw was instant form selection based off of scanning a patient's wristband. So this really creates a workflow that goes in line with what you're already doing. There's no pausing to go to the file drawer or to go to the desktop to print off the consent that you need the patient to complete. If there's an ORM message waiting that has teed up this form ready to go, or if you have even completed some of the elements of this form prior to entering the patient's room, as soon as you scan the wristband, that consent is ready to go. One additional thing that I will say is that FormFast Go also allows access to your form library. So if there are additional forms that need to be signed, you also have that ability to manually select forms if you need additional forms to be signed. Some folks have their blood consents tied in, some blood consents are separate, some anesthesia consents are separate, some are tied together. So you do have the ability to select additional forms if need be. Like we talked about before, you're really improving your risk and your compliance issues because of that standardized content that cannot be changed and required fields that are mandated. Laterality was a huge issue whenever I was still at the bedside. But then there's also that flexibility to be able to enter patient-specific, procedure-specific content, and then also expediting with that speech-to-text that Brian demonstrated as well. So overall, you're providing a better experience for the patient. You have the standardized content as well as the educational content that you can link to. You're also expediting that archival, so it's immediately available in the EHR, so the holding area nurse has access to it. So the OR nurse has access to it. Post-procedure, any compliance or inspection, it is in the EHR, it is ready to go. No one's looking for this consent form prior to surgery. And then, of course, the time savings, not only looking for those misplaced forms, but also the speed at which that you can tee up that form, have information as comprehensive as possible, limiting the amount of time that you need to take to complete the form, which gives you much more time to spend with the patient discussing the consent process rather than filling out the form. And so overall, this is providing you a more comprehensive, better form to enhance that conversation between patient and caregiver. It fits into your workflow, so you're not stepping out of your normal process of care to access and tee up this form. It's mobile, it's with you, it follows you where the patient goes. It's supporting better communication between clinician, provider, and patient. And ultimately, that is helping to prepare the patient better to be more comprehensive in the explanation of these procedures and overall give better care. So just the summary of the 4 reasons that you really want to get off paper and switch to e-consent is to accelerate that archival process, improve the compliance, help improve your patient safety and reducing risk, improve not only your clinician morale, but also reduce burnout and make your patients more satisfied as well. And then finally, improving your productivity and quality. This streamlined workflow and fewer errors is going to equal a higher quality of care. So we don't want to just be saying all of these wonderful things without a little bit more beef to back it up. And so we do have existing customers that we had a third-party company go back in and interview and see exactly what the impact was of having an e-consent process in place. And overall, there was a profound increase in operational efficiencies. So we're reducing the wasteful time, which is giving us minutes back in our day, which is crucial to having an efficient workflow for any nurse, clinician, provider. The cost reduction was profound because once this is in place, then you're not printing paper, you're not storing paper, you're not scanning paper, you're not hiring people to scan paper or have it hired out to be scanned and then securely shredded or disposed of. So once that, that initial installation is complete, you're profoundly reducing your costs. And that's also improving productivity. If you're not wasting time from explanation to consent time, you have those consents available and ready to go, then you have full procedure suites, you have full OR suites, and you're able to be more efficient with your procedure scheduling. And so I'm sure everyone on the call has an existing EHR like all of our customers, and you might be thinking, so why should I choose a FormFast solution over our current EHR solution? So I just want to share with you what our customers are telling us, because like I said, in this day and age, we're all on an EHR. But what we're hearing is that FormFast mobile app and the functionality that exists within FormFast exceeds the capabilities of their current EHR process, that the mobile features are either very limited or the mobile features are not something that are available for that particular facility. The form creation, it is very easy for FormFast to take your paper forms and convert those to electronic. Like Ryan showed you, we can do some efficient work where we're consolidating, 4 or 5 or more consents down to 1 via some of that configuration with drop-down lists and databases. And I also know from experience as an EHR builder, the process of requesting a form, having that form approved, assigning it to an analyst to build, and sometimes there's some long turnaround time there. So we can quick flip those paper forms into electronic forms and get you up and running. The ability to pre-fill as much content as possible from the EHR is a big win with our customers. And depending on the EHR, there are variable capabilities to be able to pre-fill some of the content that exists on an informed consent. Again, like Ryan showed, being able to pull in risk benefits alternatives for a variety of procedures is a really handy way to consolidate and standardize your forms. The ability to scan a wristband to pull a form up right away is also a big win. It kind of flows right into that workflow of clinicians on a daily basis rather than having to stop and manually select a form from an EHR. And then also, like I was saying earlier, using existing forms as the basis for the electronic forms is sometimes a limitation in EHRs where, depending on the type of form configuration, they might have to be started from scratch. So e-consent for informed consent with FormFast is really an easy win. Just said that we use your existing forms, so the turnaround time is very short in converting to electronic. But not only that, our managed form services team really becomes your team. So if you're thinking, I don't know if I have the staff to undergo this kind of task, that's okay. Our managed form services is your team at your fingertips to be able to manage and design your forms as you roll out your informed consent process across your organization. Go live support and beyond. So we'll be with you from the day you flip the switch and start using informed consent and beyond with 24/7 support after that. Not only that, we provide comprehensive training not only for your end users, also for the FormFast administrators in your organization. So both the admins and the super users and the end users are comfortable using our technology. And then finally, but definitely not minimally, our customer success program has really taken off as a way to continuously engage all of our customers in what products and solutions we're offering and being able to create connections not only with FormFast itself, but between customers. So we have our customer success councils, our FormFast Fridays, lunch and learns, user group, and beyond. You'll always have support and contact with FormFast and with each other to continue to learn and grow and maximize the investment that you've made in FormFast. And so with that, I will turn it over to Tommy so we can start looking at some of the questions that have been rolling in. And while that is, while he's switching over, I'd just like to thank you for your time today, and he might be able to advance to that very last slide just so you know who to contact if you would like to have a more personalized demo that's more specific to your needs, your organization. There you go. Yeah, just reach out to us and we would be happy to fine tune a demo that will suit your needs specifically. So thank you much, and Tommy, I'll turn it over to you.
Awesome, thanks, Robin. We have a few questions that have come in, and I just wanted to let the attendees know that they're welcome to add some more to the questions section of the user panel. I want to get started. First, we've seen this from a couple of attendees. Robin, I think this is probably for you. They just want to know, do we integrate with all EHR platforms?
Yeah, that could probably be for Ryan or I, but yes. Yes, we are completely EHR agnostic, so we can integrate and file back to any EHR. Yeah.
Awesome. And then the next one we have comes from William Daly. He's wondering if you or Ryan could address device management and IT integration after making the case. So I think he made a note that it seems like the point of care devices continue to grow and grow. So I'll let you take that.
Sure. So typically what we see at other hospitals are, the iPads or the mobile devices that they're using for FormFast Go and FormFast Capture are not dedicated to just FormFast. They're shared devices. They could be existing devices that your clinical staff are already using with other applications. They could be using them to access the EMR or secure texting, etc. So it wouldn't be a new device that, is dedicated just to FormFast. It could be, a shared tablet device that your staff is already using with the FormFast Go application installed on it.
Awesome. And then moving forward, we also had a few people wondering if you're able to segment your forms by either department or physician. I think mainly saying, if we have, William just chimed in there. He said he's wondering iPhone, authorization via AD. He's wondering, is this an app versus a link on the iPad? So Ryan, I'm not sure if you want to address that.
Sure. So right now it is an iPad-only application. That's FormFast Go is only available today for Apple iPads. It is something that we are working on and we'll be releasing shortly a Windows version of the application. But in regards to iOS, it's specifically just for iPads and not for iPhones. It is a native application that would be installed on the device, and that allows us to utilize the hardware in the iPad, such as the camera, to do that barcode scanning. So it is a native application.
Awesome.
And then I'm also going to just chime in really quick saying that a little bit further down the road, Android will also be available. It's future development, but it's in the works.
Great. William, let me know if that doesn't answer your questions, and I'm happy to unmute you and see if we can talk through it or schedule a personalized demo to go through it a little bit more deeply. Next thing we had, as I was saying, a couple of people are wondering how we're able to segment the forms by either department or floor or physician, just so they're not overwhelmed whenever pulling up the list of all the different consents that a hospital has.
Sure. So for those of you that are already using FormFast with web form imprint specifically, you're able to build out different locations and filters within web form imprint that pass along the FormFast Go. So you could consolidate and restrict what forms are available to different users. You could do that department specific. You can make physician filters if you'd like. If you have multiple clinics and multiple hospitals, you could limit different forms to particular buildings as well. So you could get very granular with the filters and the locations that you guys assign and create within FormFast to restrict what forms are available to different users and departments.
Great. And then we also have another question from Amber. She's wondering how the forms are selected that populate once you scan the wristband.
Sure.
So
go ahead.
I'm sorry, sorry, Robin. Yeah, I'll start with this, Robin, and then if there's anything you want to add on, we could expand on it. But typically with the form selection, when I scan Maggie, our patient, and the orthopedic consent form came up automatically, that form was previously queued up for our patient. Now, we could queue up forms through receiving messages from your EMR to schedule those forms automatically, or they could also be manually started through Web Form Imprint, which is a FormFast application, to be able to select patients and choose any of the forms to determine, what form should come up when the patient's barcode is selected. In that particular case, some organizations may choose to start filling out the forms using a regular workstation with a physical keyboard. Some staff members may be more comfortable with typing on a physical keyboard, so they may start those forms on their nursing workstation or a workstation on wheels, save it so that when they scan the wristband, that form will come up automatically. Now, we also have the ability to, when you scan a patient's wristband, if forms are not previously queued up or selected for that patient, rather than launching a blank form, what will happen is the staff member will be taken to a list of available forms based on the permissions and filters that you assign to that user, so that they can manually choose a form that they would like to start and complete with the patient.
Robin, did you have anything you wanted to add there?
Yeah, not really, other than just I have seen firsthand, that especially in, pre-procedural areas, we have very efficient nurses. And, if we have scheduled patients to come in, if there is anything to be filled out ahead of time or to be done ahead of time, they want to do it because once patients start rolling in, it's very fast paced. So I have seen firsthand the benefit of, being able to bring up that form, get everything filled out that you need to fill out ahead of time. So when the patient arrives, it is very simple to scan their wristband. The form comes up, and then you can continue to have or begin that conversation with the patient while continuing to review the form. So that's something that I've seen work well live. And then, like Ryan said, there's also that capability of receiving messages via your EHR of what procedure and consent that should pop up as a result of that message.
Awesome. Lastly, I think we've got another one coming in from Tiffany. She's wondering if it's possible to create back-end automated workflows once the consents are completed. Wondering if you could talk about dependencies based on other consents.
Sure, there are some capabilities there that will start to become a fairly complicated question. So Tiffany, that's something that we could follow up with you separately. But there is the capability of building workflows with different tasks, for archiving, sending to different people, etc. That data that's also being collected on the forms is all discrete data that can be written out to a Microsoft SQL database, which also gives you guys some other capabilities on what you could do with the data as well. But without getting too technical, Tiffany, that's something that we could follow up with you on separately to see what your specific use case is and how you would like the application to work.
Great. I think that is all of the questions that we've seen so far. If anyone wants to throw any others in before we end, I just wanted to note again that if you have any more in-depth questions or would like to schedule a personalized demo, please reach out to us at formfast.com/contact, and we will be happy to continue the conversation. I wanted to let you know also that there will be a brief survey as soon as this webinar ends that should pop up. If you wouldn't mind giving us some feedback, that would be great. And I want to thank everyone. Oh, we got one more coming through from William. How does a clinician authenticate on the device?
So for authentication onto the device, what I'm going to be talking about is specifically in the FormFast Go application. So you may have separate authentication outside of FormFast to unlock the device depending on your mobile device management strategy. But for FormFast Go supports Active Directory authentication, and it also supports local accounts as well. So for existing FormFast customers that are running Web Form Imprint and some of our other products, you're more than likely you're using Active Directory authentication already. Your users are imported. So FormFast Go would sit on top of that authentication and integrate the same way. For new customers that may not be using all of those applications or may not be using Active Directory authentication, that's something that we could add into the your FormFast environment. Or it's also something where, depending on your use case, if staff members do not all have Active Directory accounts, you could build out separate local FormFast accounts to authenticate against as well.
Awesome. I think I'm seeing from William that you have addressed his question. So he said he appreciates the answer. So thanks, Ryan and Robin. So I will leave this open just for another minute if any more questions come floating through, but I will be ending the webinar shortly, giving everyone close to 15 minutes back to your day. So got some free time. But like I said, there will be a survey popping up as soon as we end the webinar. We appreciate your feedback and hope that you enjoyed our presentation today. Thank you, Robin and Ryan, for your time. I really appreciate it.
No problem. Thanks all.
Thank you.
Hey, Ryan, we did have one last question come through from Tiffany, if you are still on the line.
I am.
She is wondering if there are ways to create notifications from FormFast to the EHR, EMR when there are forms that are outstanding. Essentially, can we have that pop up whenever there's still something that needs to be completed?
Sure. So that's, EMR specific. In regards to that, that's another fairly technical question that we'll have to discuss, individually with Tiffany's use case. But FormFast Capture is able to send out email alerts. So some EMRs are able to have an inbox which can receive those email alerts and then route it to the correct people. So there are some possibilities with integration there, but it really comes down to specific EMRs and how their environments are set up.
Thank you. And Tiffany, like we said, if we want to continue this conversation offline, we'd be happy to get into your in-depth question. Well, thank you so much, everyone, for your time today. And I'm going to go ahead and end the webinar. Please complete that brief survey as soon as it's closed. Thank you.